let's do this. Let's use the method. So what is the method? The method is what? We start from the bottom and we work our way up. So the nurse is caring for a child and is monitoring for which of the following adverse effects of IVIG. Wait a minute. Okay, cool. Why is this child getting IVIG? A 4-year-old. Why did I give it age? Diagnosed with, Kawasaki's disease. All right, somebody talk to me. With Kawasaki's disease, I'm worried about two things. First and foremost, talk to me. I'm worried about bleeding. And where am I worried about the bleeding? The heart. The coronary arteries specifically. But then again, they develop a fever. How high is their fever? 104 to 105. Yeah. So bleeding is going to be which one of Asgraf? Hemorrhage, hemorrhage, hemorrhage. A high fever is going to lead to what? Altered mental status by way of seizures. Good. But we started them on IVIG. But wait a minute. Look, I've taught all this. Y'all better know this. But what about IVIG? Am I worried about? A child receiving IVIG, what am I giving them? What is IVIG? Let's break that down. Intravenous immunoglobulin, right? So I'm giving them an immune system, an exogenous immune system. So now, what type of an issue could I develop here? And obviously the answer is in front of you, but let's think it through. Bleeding is what we're concerned about. Is that a distractor? Yeah. I threw that in there for a reason. Hypotension, well, if they're bleeding, you think they're going to be hypotensive tachycardic? Yes. Hyperkalemic? Threw that in there as just an answer choice. But if I gave you something that your body was not normally used to, what just happened? What could just happen? How about that? Allergic reaction, or what do we call that? Anaphylaxis. So you see, when we look at these questions, because now I'm putting questions in front of you that are a little bit more complicated. But if you're going to answer this question right, do you think I'm concerned about you passing your boards? Not the least bit. Can we bleed? Well, that's what we're worried about. Coronary artery aneurysm. Hello, we've talked about it. Well, if I'm bleeding, am I going to be hypotensive? Yeah. Hyperkalemia? Well, maybe I'm talking about heart. Maybe I'm trying to confuse you with heart failure, whatever. But the truth of the fact is, if I give you something that your body's not ever been exposed to, anytime, and this doesn't just go with IVIG. How many people in here have children or nieces or grandchildren or whatever? How many people? There you go. When they get exposed to something for the first time, especially by eating, Peanut butter, good. Look, this didn't happen when I was growing up. My snack shack didn't have no allergy notices. Honey, good. These are all things that can cause initially an allergic reaction, but we're not just worried about an allergic reaction, we're worried about anaphylaxis. And the biggest ones are what? Nuts and eggs.